If there's one condition that causes so much stress for women, it's hair fall. And sometimes we don't know whether the hair is falling from the root or it's a hair breakage, and there's a lot of confusion regarding this. So here we are today to discuss about the difference between hair loss and hair breakage. I am Dr. Rasya Dixit. I'm a dermatologist in private practice from the last 18 years. I'm practicing in Bangalore, and here I am to talk to you about hair loss versus hair breakage today. When we talk about hair loss or hair fall, usually dermatologists are talking about the hair loss which is happening from the root of the hair. So you are losing the hair from the root itself. Whereas hair breakage is the breakage of the hair from the shaft at whatever distance. Let us look at what are the causes of hair breakage. We have discussed extensively in our videos about the causes of hair loss in women, which range from acute telogen effluvium, chronic telogen effluvium, alopecia areata, vitamin deficiency, hormonal problems. But today, the focus is shifting from hair loss to hair breakage. So, in today's world, you know that women are expected to be groomed, so we are doing a lot of treatments, whether it is chemical or physical treatments for our hair. Chemical treatments could range in the form of hair coloring, hair botox, hair straightening, hair cysteine treatments, which are all also with combination with bleaching or not bleaching the hair, all of which are actually destroying the chemical bonds which are there in the hair shaft itself. So these treatments over a period of time are going to make the cuticle weaker. So the hair cuticle is going to become weaker over a period of time with repeated such treatments, and what is going to happen is it's going to be prone to more easy breakage. Use of tight hair bands, use of tight ponytails, using a tight swimming cap, for example, may also promote hair breakage. So how do you identify whether your hair fall is a hair fall or it's a hair breakage? Observe the ends of your hair. When you see the hair has fallen on the floor after a shower, observe the ends. The tips usually will have a bulb which is present if it is coming from the scalp, and it will have a frayed end which is there, which is present if it is a hair breakage. So your dermatologist can also help you diagnose this by using something called a trichoscope. If they observe it under the trichoscope, they will be able to tell you whether it's a hair breakage or a hair fall. The second thing is that if you have hair breakage, what are the things that we have to do? Hair breakage is a damage to the shaft of the hair. So the first step to treating hair breakage or split ends or physical breakage to the hair is stop doing all the things which I spoke about, which means no more heat tools on the hair, no more coloring, chemical colors to the hair, no more use of harsh bleach to the hair, don't use tight hair bands or hair ties, and then invest in a good intense repairing sulfate-free shampoo and conditioner and an intense repair serum which has to be used after every wash. Second, minimize use of hair color, minimize use of hair dye, try to do it as less as possible. Third, pay attention to your nutrition. This nutrition is not going to be able to repair the hair which is already damaged, but it is going to make the roots to grow stronger so that the volume and the hair length can be quickly replaced back. Fourth, make sure that you're taking adequate amount of calcium, iron, biotin, zinc and micronutrients in your diet along with your proteins and essential fatty acids, because this is going to make the hair more vitalized and it is going to make the hair grow more stronger. If your hair is very severely damaged, I usually advise my patients to get a haircut so that the split ends or the breakage part is removed and the rest of the hair can grow healthy with this nutritional diet and exercise. Always remember that whenever we talk about skin or hair, diet, sleep, lifestyle, these three things cannot be ignored. So whether it is smoking, whether it is alcohol, whether it is not adequate sleep, they are all going to affect your hair as well as your skin. So these are the tips that I have for you to take care of your hair. But if you still feel that the hair is not improving, then it may be indicative of some more severe deficiency, something which needs more medical attention. Then you have to talk to your dermatologist who can help you. Thank you for watching. Like, share and leave a comment if you have more questions for me that you would like me to answer.